One of the first materials you'll need when suturing is a pair of rat tooth tweezers. These will be used to separate the skin in order to best insert the needle. The next is a pair of needle holders in order to hold the needle. And the next is a pair of scissors in order to cut the sutures. For our demonstration, we'll be using a nylon suture and a fake skin model. When opening the suture, it is very important to maintain sterility. This is done by ensuring that, in our case, the table, in general, the workspace, is sterile, as well as the hands or gloves. When opening it, you want to expose the needle so that way you can grab the needle with the needle holders. The needle holders should be held with the thumb and middle finger.
Next, you're going to want to make sure that you are holding your needle properly with your needle holders. You want to hold this perpendicular at 90 degrees and 2/3 of the way from the tip. Here's a close-up from Alibaba.com. Normally, curved needles are used because they're the quickest to suture with. Next, we're going to be talking about our pad, which has 3 layers. You would only want to suture the first 2 layers and never go too deep to the red, which is the muscle. And here is our cut. As you can see, this is what we'll be suturing. Now let's move on to our important first steps. So what do you need to know before suturing? So you need to always maintain antiseptic techniques. This includes using sterile instruments and appropriate surgical preparation of the patient. You also need to use sterile gloves and appropriate attire and perform the suturing at the appropriate location. You always need to maintain sterility during suturing. You also need to make sure that the wound is properly prepared for suturing before beginning. For this, you need to trim the area along the wound to ensure proper airflow. Normally, this would be suggested to have about 1/2 inch of hair-free area around the wound and then wash the wound to make sure that there are no bacteria or debris in it. Wash with soap and rinse with warm water for about 2 minutes and pat dry with sterile gauze. Now let's get into the actual non-continuous suturing technique. After you make sure that you're using antiseptic techniques, you take your skin forceps and use it to manipulate the skin around the wound in order to be able to poke the curved needle through the wound with your needle holders. You're going to want to go all the way through the wound. Make sure to pull the suture material through the wound, but leave a tail on one side of the suture. Then you use your forceps again to manipulate the skin and poke the needle through the middle of the wound to poke outside through the other side of the wound. You want to make sure that you're doing this properly so you know that your suture material is making a square under the skin. After the suture material has gone through both sides of the wound, you're going to want to wrap around your needle holders twice and pull the tail through those 2 wraps in order to make a knot. You're going to want to repeat this a few times. 3 is a good number. Again, you go over the needle holders twice and pull the tail through the 2 loops and pull tightly, but not too tightly. And that is your non-continuous suture. Never forget to clip the excess suture material, of course. Here is a time lapse of the rest of the stitches. The same procedure is used, using the forceps to grip the skin, poke the needle through all the way through the middle, pulling the suture material until there's a small tail. Then the needle goes through the middle again, as you can see here, and is pulled all the way through in order to make sure that there is a square forming under the skin. Wrap around twice and pull the tail through. Repeat 3 times in order to make a knot. Here it is again. You take your forceps to manipulate the skin, poke the curved needle through the wound and out the middle, pulling the suture material through the middle and leaving a tail. Then you take your forceps again, use to manipulate the skin and poke the needle through the middle of the wound and out the other end. Pull the suture material all the way through, and you, holding the suture material, you wrap it around your needle holders twice and pull the tail through, and repeat that same step 3 times. Wrap around twice, pull the needle through, and cut the excess off. When doing your non-continuous sutures, you need to make sure that your sutures are evenly spaced and have a consistent length along both sides of the wound in order to have a proper stitch that will remain closed and avoid any debris or bacteria getting into the wound. Normally, you would use a interrupted suture or a non-continuous suture, either or. It's the same name for the same suture for wounds that are at risk of opening, and so since this has individual knots, if one knot opens, then it's no big deal and the suture would still stay intact. The only problem with this is that it may be too expensive to use so much suture material, and it also may increase the possibility of wound contamination since the wound is open for so long, since the sutures take a while to do, as you can see by the sped up video, which is still rather long despite it being sped up. And there you have it, our last suture. Clip the end of it and you are finished.